Reconstructive urology was, let's say, is a subspecialty which is evolving in India, but it's a well-defined subspecialty in abroad. Reconstructive urology has two components. One which deals with urethral penile surgery, and second thing is a very fancy name for that is cosmetic urology. So if you look at the urethral penile surgery, it's a very much neglected part in India, though it's a big market in abroad, but in India, urethral problem as well as penile deformities are not dealt with properly. In this category are the patients who have strictured urethra, penile curvatures, hypospadias, epispadias, and other penile deformities, or the scrotal deformities. These patients are either from the low socioeconomic strata, or these are patients who have already been mismanaged by various doctors. If you look at the strictured urethra, this is a big problem if you consider from the urology point of view, because there was dictum initially that once a stricture is always stricture. But I'll say it's a very wrong statement, and in 21st century, being a reconstructive urologist, I really condemn this statement. Stricture are quite common. Initially it was considered a rare problem, but nowadays with too much intervention, urological intervention coming up with the instruments, endourological instruments, stricture urethra is a very common problem. People are coming with different kind of stricture, different length of strictures. The problem which we face in India is that the patient first goes to private practitioners, or we can say RMPs, who have no clue how to manage a stricture, and they send them to mostly to general surgeon who try dilatation, or if they are bit versed with endourological procedure, they do optical urethrotomy. I'm not saying optical urethrotomy is a wrong mode of treatment, but it has very defined indication, and you can say very limited indication. So stricture urethra, the best treatment which we can offer for stricture urethra patient is urethroplasty using different augmentation material like buccal mucosa, lingual, preputial graft, and results with urethroplasty is almost 90 to 95%, which is not at all achievable with optical urethrotomy. And the problem with the optical urethrotomy, one more problem with optical urethrotomy is that patient has to do self-dilatation, which is not the right thing to be advised to any patient. In urethroplasty, self-dilatation is not required, results are good, and it's one-step solution for any kind of stricture urethra. If you look at other aspect of reconstructive urology, hypospadias repair, this is done by all kind of super specialists like pediatric surgeons are doing, plastic surgeons are doing, and hypospadias is quite prevalent, and my opinion is that hypospadias should be done on a priority basis by in a very special way, because we don't want the child to suffer in future because of any wrong surgery done by any surgeon. Hypospadias repair give very good results if it's done properly, and patient can have a normal urination and sexual life later on. If you look at the penile curvature, or the thing which can happen, which can cause penile curvature, is Peyronie's disease. Peyronie's disease occurs mostly with patients in the age group of 40 to 45 or 50 years, when they are sexually active, but they do not have that much hardness in the penis at the time of erection. And sometimes the trauma can occur to the penis and can lead to formation of fibrous or hard plaque, which later end up with Peyronie's disease. The treatment of Peyronie's disease again start with counseling. Later on we have oral medication and injectable therapies in which drugs are directly injected into the penis and the plaque. But the results are around 50%, and none of the drug or the injection therapy is approved by US FDA. So once the plaque is well defined and patient have problem with the plaque in the form of penile pain at the time of erection, curvature, defined curvature in the penis, in this patient the best treatment option is surgery, and the surgery leads to very good result in the form of 90% to 95% decrease in pain and normal sexual life with good erection with surgery. Causes of stricture urethra are previous instrumentation, history of infection, urine infection leading to urethritis, or history of any trauma to the pelvis or perineal region, and in pelvic fracture, end-to-end in pelvic fracture, trauma to urethra can occur, leading to total disruption of the urethra. A patient of stricture urethra can present with retention of urine, that the inability to pass urine. A patient can present with decreased flow of urine, passing urine in drops, or there is some recurrent infection in urine. And the patient gave history of straining in passage. Patient gave history of difficulty in passing urine with straining to pass. To form a normal flow or a stream of urine, and these patients should be evaluated with proper history, ultrasound, and dye study in the form of retrograde urethrogram and micturating urethrogram to define the cause of problem as well as the length of stricture, which will decide the